Welcome back to another episode of 5 Minutes in GI, a show where we try to answer the most frequently asked questions about GI disorders in just under 5 minutes. I'm your host, Alyssa Sutton, and I'm the program coordinator for the International Foundation for Gastrointestinal Disorders. Today, I am so happy to welcome back Dr. Dariush Shahsavari. Dr. Shahsavari is one of IFFGD's junior academicians, and he is currently completing his final GI fellowship year at Augusta University as the Chief GI Fellow. Dr. Shahsavari, thank you for joining us once again to answer another question that we have about gastrointestinal disorders.
Of course, Alyssa, happy to be back. Thank you.
So today's question is, why is it common for people with asthma to also struggle with GERD?
Yeah, so that's a very good question, and it is common that people with asthma have the two conditions, and these two conditions actually they affect each other in different ways. GERD is a condition where the stomach acid basically flows back into the esophagus, the food pipe, causing symptoms like heartburn, chest pain, and sour taste in the mouth. And asthma, on the other hand, is a chronic lung disease that can cause narrowing and inflammation of the airways. And this leads to symptoms like coughing, wheezing, shortness of breath, or chest tightness. And it is interesting to know that actually 60% of patients with asthma have GERD, but only around 4.5% of patients with GERD have asthma. This might be a little bit underestimated because some of the patients with what we call extraintestinal manifestations of reflux may not be identified very easily, and not everybody has typical symptoms. And we're not sure what the real reason is and what is the association between the two, but there are some theories. One of them is the reflux theory, obviously. A direct mechanism where the reflux, or the material from the stomach kind of enters the esophagus and subsequently leads to what we call microaspiration, which means that the content may inadvertently get into the lungs and the respiratory system and the pulmonary tree. And the aspiration of the content can result in stimulation of the larynx, the pharynx, basically the voice box and the throat. And this leads to symptoms of that we talked about, like cough reflexes. This chronic inflammation in the lungs also leads to airway obstruction, lung injury, and that increases the resistance and inflammation, and that's where you see the manifestation of asthma. Another possible mechanism or explanation and association between the two is that during asthma attacks, basically the patients have increased pressure in their chest and their abdomen, and that might push the content of the stomach up into the esophagus, and the patients may have the symptoms of GERD. And finally, and this is not very common these days, some of the medications that we used to treat asthma with, things like theophylline, they also have a tendency to relax the esophageal sphincter, the sphincter at the bottom of the esophagus, and that leads to more reflux. And basically, it's very important for people with asthma and GERD to treat both conditions and avoid factors that trigger them. Things that can potentially trigger symptoms associated with GERD are obesity, smoking, alcohol, certain type of food, spicy food maybe, and certain type of medication, one of them that we mentioned. And some of the treatments and lifestyle medications are pretty much similar between the two. So if patients are experiencing symptoms with asthma and at the same time also reflux, treating both of these conditions can be helpful to treat the common symptoms between the two.
Thank you so much. You actually answered one of my questions that I was going to ask, which was if you have both asthma and GERD, is there any difference in treating both of those two different conditions? But you basically answered that by saying, really just making sure you do treat both individually, and treating the GERD, you can still make those lifestyle changes, make those diet changes, and also avoid those triggers that can definitely set off not only your asthma, but also your GERD. That is all the time that we have today. Please don't forget to hit the subscribe button. And as always, if you have a question after watching this video, please feel free to leave a comment below or email us directly at iffgd@iffgd.org, and we'll do our best to answer your question in another episode of 5 Minutes in GI.